Dr. Connor, you are someone that I truly hold, in high regard, but also appreciate because, we talked before, you take care of a family member of mine, and that just, what you're dealing with glaucoma is something that we all understand is something that's very frightening for patients. So thank you. Welcome. Looking forward to having a chance to chat. So, well, how are you?
I'm well as I think any of us are these days. It's a sort of a different world that we're living in than the one we were living in 6 months ago, or certainly a year ago. But I feel blessed in a sort of perverse way that the work that I do as a glaucoma clinician and surgeon is work that never really goes away. So even in these tough times, there's still lots of patients who need our help, and we've been busy throughout even the worst parts of the pandemic in the spring, taking care of patients.
Dr. Connor, I had a chance to look over your bio sketch and your resume and everything that you'd sent me, and like everybody, you've done a tremendous amount of education. And I remember when you were here doing your fellowship, didn't seem like it was too long ago, but it's been a few years now that you've done it, and so you trained at West Virginia, and then a lot of your training here at the University of Pittsburgh. But before that, and maybe along the path that you were doing and getting your education, at what point did you just decide that medicine was going to be a path for you, and that you really wanted to kind of look into making this your career in caring for patients?
Well, it's interesting. I'll admit I did not have that epiphany when I was 8 years old or anything like that. I was sort of a nerdy kid. I was interested in math and science and biology and all of those things. So I went to WVU and studied chemical engineering there, which was really was, I think, great preparation to go to medical school from a science, grounding and science standpoint. But even at that point, in my late teens and early 20s, I wasn't certain that I knew what I wanted to do with my life. But then I had an experience where I actually worked as a chemical engineer one summer while I was an undergrad, and it became very clear that that was not the life that I was interested in. So chemical engineering has a lot of fluid dynamics associated with it. We're moving fluids around from one process unit to another. So as I entered into medicine, I found myself attracted to fields of medicine that had an overlay there. And ophthalmology and glaucoma in specific really does have a lot of overlay because we're, with the surgeries we do, really concerned with pressures and with moving fluids from one biologic space to another. So it sort of fit my natural interests that came along as I moved through my education. And at each time that I needed to make some decision about what the next step would be, it always seemed that the obvious choice was the one that they ultimately made. So the obvious choice to go to medical school, the obvious choice then to pursue ophthalmology, and then the obvious choice within ophthalmology to become a glaucoma surgeon.
Well, and you mentioned, your engineering background. I'll tell you, I'm always impressed every time I'm looking through all the research that's going on in the department, and particularly the research that goes on in glaucoma. I know your primary focus is your clinic, and you're very, very, busy clinical practitioner. But you make time to get involved in a lot of research, and you're on a lot of projects. So obviously, advancing care is also something that's really important to you, and something that you are very focused on and very interested in. What are the things that we should be thinking about and excited about as it relates to the way that maybe the University of Pittsburgh will play a role in advancing care for people with glaucoma?
Sure. Well, first, thanks for saying that about my involvement in ongoing research projects. I have to give all credit to my collaborators and the other faculty in the department here. as well as in the School of Engineering here at the University of Pittsburgh. We have really brilliant folks doing really fascinating research projects here. And I'm very fortunate to be able to work with a lot of those folks in helping turn their projects into clinically relevant aims and goals. So I think that that's really where I can contribute the most, is in understanding how patients interact with technologies, for example, and providing some guidance and assistance. My screen just disappeared there. Modern life, right?
It's
Some
finding life.
guidance and assistance in helping gear those projects. So all of that said, I think in glaucoma, although I'm really excited to be doing this in the era that we're in, where we have a lot more treatment options, including many different types of surgery than we ever really did before. So we have an opportunity to individualize care based on a patient's specific needs and the stage of their disease, the aggressiveness of the disease, and so on. Even though we have all of those options, we still fundamentally are motivated to lower the pressure. It's sort of strange that all these years in, that really is the only gear that we know it makes a difference when we turn that gear. So some of the projects we're involved in are trying to better understand how the forces within the eye interact at the optic nerve head. The optic nerve is what's damaged in glaucoma, to create disease and vision loss, and how better to do things that may provide some resiliency to that optic nerve head. So I think I'm not alone. There's a lot of people in the field of glaucoma who really understand and are motivated to find ways to treat the disease that doesn't just rely on lowering the pressure, because there has to be other tools in our arsenal to treat this disease.
Yeah, I certainly have learned a lot about glaucoma, just from you and all the faculty, and how complex it is. I mean, it isn't is simple to understand as you could understand maybe how pressures in the eye and can affect the back of the eye and cause damage to the optic nerve, but then we have people that have normal pressure or even somewhat low pressure who still develop damage to the back of the eye, and that still falls under this phenomena of glaucoma. And it's just understanding the variances there and the complexities. So what are the things that can make a difference for people, say with are there tools and strategies that will make a difference for people with low pressure glaucoma that may enable us to have more tools, like you mentioned? What are the things that are most exciting to you that you hope that we can accomplish?
Well, I'll tell you, Lonnie, you really cut right to the bone there. Low tension glaucoma is one of the toughest entities within our spectrum to manage, because you're right, there are patients with normal or even low pressures who can have glaucoma progression. And I think it really speaks to this concept that there's variable resiliency of the optic nerve. And that's, the thing that we really have to better understand. And the fact is, we're still at a rather rudimentary understanding of why that happens to some patients. So for the individual patient, the most important thing is that they acknowledge and take ownership of the fact that they have a potentially vision-threatening or blinding disease, and maintain, just like patients with other chronic diseases like the diabetic or patients with cardiovascular disease, maintain that connection with their doctor, with their glaucoma specialist in this case, in order to monitor for progression. And if there is progression, then we have the tools that we have, and those tools are becoming broader all the time, but we have the tools that we have to lower the pressure and to change the course of the disease. As far as things like exercise and nutrition and things that the individual patient could do, certainly there is some evidence that moderate amounts of exercise for Any disease entity is usually good because it improves blood flow to the organ of interest. So no matter what ails you, getting some regular exercise is a useful thing to do. And in the West, our diets are notoriously worsening year by year. So certainly, taking in a moderate amount of fresh or cooked fruits and vegetables appears to be useful as well. But there's no dietary supplement that's been proven to really make a difference for patients with glaucoma. So these are discussions that the individual could have with their doctor. But the fact is, there's no well-controlled clinical trials for any type of supplement that might be out there for the management of glaucoma.
Well, you mentioned that for a patient that's been diagnosed, certainly making sure that you take the matter seriously, get to your physician appointments, make sure that you're getting that checked. If someone's doing that and they're really staying on track and they're really if 100% of your patients were doing that, do you feel confident that a majority of them would be managed quite well with what tools you have today?
Yes. So, the other part of that is early diagnosis and treatment from an early stage. So, I tell people when I'm diagnosing them with early stage glaucoma, with mild stage glaucoma, with very little or no vision loss, but clearly they've lost some optic nerve, fibers. So structurally, we can see that there's a disease that with regular follow-up and management from an early stage, I don't anticipate that anyone really needs to lose vision, right? I anticipate that in the vast majority of cases, we can manage their vision and maintain their vision for the rest of their life. There are exceptions to that rule, of course, but patients with glaucoma who are managed from a relatively early stage should not expect that they're going to go blind. This is a rare event for those patients. The fact is that most of my patients who lose vision or have lost vision are diagnosed very late in the process. So they've already lost a lot of vision. It's certainly enough vision that they can notice a problem with their vision at the time that they're diagnosed. And for those, it's a much more, unfortunately, common occurrence that, we can't get the vision back that's lost, and sometimes they go on to lose more vision. The analogy that I use in my clinic with patients, and maybe by putting this in the webinar, I can say it out loud less frequently, right?
Right.
But the analogy I use is that the management of glaucoma is like stopping a snowball from rolling down a hill. So if you notice that there's a snowball and it's starting to roll down the hill, but you notice it at the top of the hill when it's very small, it doesn't require a lot. I mean, it requires vigilance and it requires some form of management, but it doesn't require a lot of effort to maintain that snowball at the top of the hill. Maybe this is a bottle of drops, a single bottle of drops that you use once a day. Maybe it's a laser that we do in the office, but it's a relatively straightforward thing to prevent that snowball from rolling any further down the hill. If you don't notice that you have a snowball rolling down the hill until halfway down the hill, now the snowball is this big around, it requires some effort, but you can stop the disease progression. Maybe this is 2 bottles of drops, maybe this is a surgery at this point, but you can generally manage it and prevent the snowball from rolling any further. Unfortunately, if I'm only meeting the patient or we're only diagnosing the disease or coming into the picture when the snowball is nearly at the bottom of the hill and it's bigger than I am, sometimes no matter what we do together to stop that snowball, we're both going to get rolled over. Yeah. So it's a disease with momentum, and the longer it goes, the harder it becomes to manage. The more vision loss there is at the time of treatment, the harder it is to stop that from progressing.
Yeah. So, well, it says a lot for early detection, as you said, and again, maybe just overall, just for the healthy people who think they have good vision and not knowing that they need to just get in and get their eyes checked, get their pressures checked, see the optometrist. So, well, you've been here, as I have, for a number of years, and there's been a lot of changes in the department, a lot of growth, in terms of number of faculty and a lot of new scientists and new things on the horizon. what are the ways that some of those changes and those developments will impact you and the glaucoma service? And is there anything that that gets you, that's enthusiastic, I guess, to you as far as what we can do again for your patients in the future, coming out of the University of Pittsburgh?
Right. You point out that we've had a number of, additional faculty, including within our own division. So we're certainly excited about the growth of our division that we've seen and that we expect to continue to see. That allows us to provide care to more patients, obviously, and to reach out to patients who may be in more outlying communities. So we're working on that, both for live visits as well as hybrid visits where patients could potentially come and have some of their testing done in a remote clinic, and then have a video visit type of follow-up with their clinician. So some of that has been forced, obviously, by the pandemic, the ongoing pandemic, but I think that it's an unquestionable good for a lot of our patients, and we expect that to continue even as pandemic restrictions are lifted, in the future, whenever that happens. We're really excited about, obviously, the Vision, Institute or Vision Tower. The name's changed a few times, but the new Vision Center adjacent to Mercy Hospital uptown. The facilities there will really obviously be top notch, including the operating theaters, which is a big deal for surgeons. Our ability to provide education, both regional and national education via remote seminars and things like that is really going to be amazing. And our ability, I think, to incorporate clinical trials into what we do in glaucoma will really be enhanced there as well. Space is an issue in Oakland. It's been an issue in Oakland for 100 years or more. And it continues to be an issue. So some of the things that we've always wanted to do here have just always been a little limited by that, and we'll be able to get patients in for those kinds of trials, I think, much more easily in the new facility when we get there in another year or two.
Yeah, it's closer than we think. I hope what I'm hearing, end of 2022, early 2023.
Yeah, it's very exciting.
It is very exciting. Well, thank you. I think we'll kind of end it this way. If you were, to say to, patients or even maybe people who are just interested in, maybe have family risk factors and other things like that. What are the most important thing people can do to make sure that they're preserving the health of their eyes and really their vision as you go through life?
Right. So the most important thing is that you have your eyes examined, and you don't need to see a specialist for that. If you don't have any other signs of disease, you can see an optometrist or a general ophthalmologist. And one of the things that they do when they examine patients is to screen for glaucoma. Their exam incorporates screening for the presence of glaucoma. It's both the pressure measurement and the observation of the optic nerves. A lot of my patients come from comprehensive ophthalmologists and from optometrists when patients fail the screen, so to speak, right, and they come for a deeper evaluation. So that's the most important thing. It's less common in young people. It's the primary risk factor is age. Certainly family history plays a role, but age is predominantly it. So you get into your 40s and 50s, if you haven't had an eye exam for a decade, it's probably a good idea to go ahead and have that done and see if there's any signs of disease there. And then aside from that, we talked about some of the lifestyle things, the exercise and the diet, and don't smoke, please. We've come a long way, I think, as a society in the last 10 to 20 years of reducing smoking rates, but that's probably the worst thing you can do for a lot of your health, but your eye health as well.
Health of your eyes, yeah. Well, Dr. Connor, thank you. It's always a pleasure. You're really, again, someone that everybody here holds in high regard for what you do clinically. The patients as well as all of us that work with you. And you know, you're just someone who's plays a key role in what the institute is going to be able to do for patients in the future. And thank you for all that you do. Have a good day.
Well, I appreciate it. Thanks, Lonnie.